There you go.
I'll be there. I'll be joining.
Yes.
It's a very important conversation. Reporting the domestic data exchange program. How do you go about it? People will be impacted differently, and based on how you're impacted, you would have to report it, and we'll see how it goes. But score big with the ABSA card assist to win an all-expense paid trip to watch a Premier League match live in the UK. Simply sign up or reactivate your ABSA debit or credit card to make all your POS or online payments from now to the end of March, yes. And the more you transact, the more points you earn to be part of our top 60 scorers with the highest points to win loads of amazing prizes such as smart TVs, sound systems, refrigerators, deep freezers, air conditioners, washing machines, smartphones, and shopping vouchers with a grand prize of an all-expense paid trip to watch a Premier League match live in the UK going to the highest point winner. You should watch Man United play. Hurry, sign up or reactivate your ABSA debit or credit card today and transact more to earn more points or win in the ABSA Card Assist promo. Terms and conditions apply. That's Africanacity. That's ABSA, the official African banking partner of the Premier League.
All right, let's talk about this vaccine shortage. It's hitting hard on healthcare delivery across the country as many newborns are exposed to childhood killer diseases. Reports are that almost all district hospitals have run out of the essential vaccines administered to children at birth to prevent deadly diseases like measles, among others. Now, the absence of these vaccines will mean newborns are prone to attacks of such diseases and can lead to possible death. But the health minister, Kweku Agyeman-Menu, has defended his ministry's inability to provide these vaccines, explaining that the situation is not peculiar to Ghana only, but a global challenge. There was a meet the press, and he spoke about that yesterday at the Information Ministry. Let's hear him.
That we have had some vaccine shortages in the country since the last quarter of 2022. The vaccines in short supply are BCG, measles, rubella, and oral polio vaccine, OPV. This shortage is nationwide. The recent shortage in vaccines for measles, as regrettably as it is symptomatic of the steady global decline in measles vaccination since the beginning of the COVID-19 pandemic. And permit me, from a WHO recent publication on the subject, that puts the challenge we are dealing with into perspective. And I will quote, measles vaccination coverage has steadily declined since the beginning of the COVID-19 pandemic. In 2040 million children missed a measles vaccine dose. 25 million children missed their first dose, and another 14.7 children missed their second dose. A joint publication by the World Health Organization and the United States Centers for Disease Control and Prevention reports. This decline is a significant setback in global progress towards achieving and maintaining measles elimination and leaves millions of children susceptible to infection. In 2021, there were an estimated 9 million cases and 128,000 deaths. 22 countries experienced large and disruptive outbreaks. Declines in vaccine coverage, weakened measles surveillance, and continued interruptions and delays in immunization activities due to COVID-19, as well as persistent large outbreaks in 2022. Meaning that measles is an imminent threat in every region of the world. The paradox of the pandemics against COVID-19 were developed in record time and developed and deployed in the largest vaccination campaign in history, and millions of kids missed out of life-saving vaccinations against deadly diseases like measles. We have made all necessary efforts to ensure that despite these challenges, we secure adequate stocks within the next few weeks. It is important to correct the erroneous impression that there have been deaths from measles in Ghana recently. For the avoidance of doubt, there have been no deaths from the recently recorded spike in measles cases. Indeed, there have been no deaths since 2003 in our country, though we have recorded cases annually. Finally, despite the challenge, Ghana's immunization coverage remains among the best in the world, and in 2021, we recorded 95% coverage. working with UNICEF, we are fast-tracking the processes, and it is expected that vaccines will be supplied in the next few weeks, all things being equal. The Minister of Health, ladies and gentlemen, will ensure that we stay on track with immunization record and quickly overcome these bottlenecks. On 29 June 2022, part transfer of funds to settle Ghana co-financing and cost of traditional vaccines and devices for 2022 from NHIA, 25 million Ghana cedis. On 7th October, for transfer of funds to UNICEF to settle Ghana's co-financing and cost of traditional vaccines, 10,750,000 Ghana cedi. 22nd November 2022, part settlement of GOG co-finance obligation traditional vaccines and devices, 30,111,000. 31st December 2022, when the year was coming to an end and we needed to ramp up our monies that NHIA should give us, we also did under transfer similar narrative, 23 million Ghana cedi. In all, we have a total of 71,861,000. How does it compare with 72 million? Apparently just about the same. And the irony of it is that that man has got this.
Yeah, so that was the the health minister, Kwekwaji Mamenu, explaining the shortage. But look, this thing has real world impact on real people. People are having kids every day of the week. And there are those who have children, and if you can imagine your child being vulnerable to a disease that can kill this child, even though decades ago the world found a solution to it. But your government has failed to spend the money that they were supposed to spend to buy that solution to protect your child. How must that feel? I wonder. I mean, I'm sure you get the chance to tell us in a bit, but Bernice Abubedu Lansa is here with us, celebrated news anchor. Bernice Abubedu Lansa.
Thank you, Kojo. Hi, guys.
This is a story we've all, had to cover. I wonder how it strikes you.
Well, I've had a personal experience, and this was about 3 months ago, and I had taken my little boy to get his normal shots, and I had never encountered that excuse. We don't have any vaccines available. So I went the following month. This is usually done on a monthly basis. And then they said, we still don't have it. And interestingly, this was at the time they had just finished the wild polio vaccination. I don't know if you remember that there was a mass vaccination drive. So I was like, this is kind of counterproductive, because I don't see why you're doing wild polio and then this for the babies, which they're supposed to just have a drop in their mouths. We don't have that. So I went on another occasion, and this time I thought the nurses were just being difficult. So I picked up my phone to call one health official at the Ghana Health Service, and he didn't admit, but he didn't deny it either. So I just said, look, I was just going to try the next month. Thankfully, when I did go the next month, I got the vaccine for. But during the period of waiting, it was quite uncomfortable for me, especially for the polio, because I was, thinking to myself, what would I do if my child contracted the virus and couldn't get the opportunity to use their legs, as they could? Effectively, if they were affected by the virus. And another thing I witnessed was that because there was a shortage, many people were just avoiding it altogether. Some mothers had stayed home for so long because they couldn't afford to keep coming all the time to get the vaccine. There was a case I witnessed. They were twins, and the father had brought the children the month before, and they could only afford to give one of the twins. The mother brings them the next time, and she cannot tell which of the twins got the vaccine.
What?
And it was such a debate, because there be okay papa because we can't give a double dose. It was so confusing and so untidy. So this is really frustrating, and I don't know how we can do this but get the vaccines. There's no way around this. We just need to get the vaccines, because the longer we take, like the doctors have told us, the kids are vulnerable to contracting these viruses.
It's a big worry, and thanks for that personal experience. I have no doubt there are many who can relate. This is the scene in many clinics and hospitals across the country. We're joined by Kwame Sapon-Asiedu. Ray and Winston and myself are here in the studio. Kwame, I mean, this is something that you have unique knowledge of. I mean, your work puts you right in the middle of global supply chains when it comes to things like this, and you have given us so much information about the COVID vaccine and its movements across the globe. Now we hear the health ministry say that the shortage in Ghana is because of a global decline in childhood vaccinations. Tell us, from where you sit, is that what you observe?
Thanks, Kojo. Yesterday, I made a post on Facebook, and I'd repeat it on air. I was scandalized by that statement, and I'll tell you why. I was scandalized because the quote he referenced regarding the WHO and the United States CDC is accurate. And it's accurate in the sense that at the height of COVID, and I remember, like you rightly pointed out, that I pointed out this when India had a high COVID and Serum Institute of India couldn't manufacture vaccines for COVID, and there was a global shrink in the supply chain of COVID vaccines. I said there was the likelihood that moving forward, it would impact the production of other vaccines. And so what has happened is that there has been a global decline in the uptake of the measles vaccine, but that doesn't mean there is an undersupply or there's a global shortage. The two are different. The global decline has been because health systems have prioritized over a period of time, given the COVID vaccine, compared with their other childhood immunization vaccines. Second, because of the lockdowns and other things, a lot of parents didn't take their children who had at the height of COVID for the first, say, 16 to 18 months for these vaccinations. So what then happened was that there was a drop in the utilization of the vaccines, which by default, when you go to the Serum Institute of India website or the Biological E, which are the biggest producers of these vaccines, you would see that as a result of the decline, their projections for global manufacture also dropped, because vaccines have a very short shelf life. And therefore, if you are a producer, you would not want to produce vaccines that would expire and you incur loss. So you project based on the previous year's uptake, the global population growth rate and birth rate, what the expected uptake would be in the next year. Unfortunately, due to COVID, that trend dropped. So these manufacturers were manufacturing slightly lower than what they had originally manufactured in, say, 2019. As a result, and if Kojo and Winston, you check your WhatsApp messages, I've sent you the UNICEF circulatory indicative prices for all the vaccines that we need to buy that were issued by UNICEF in June 2022, updated in October, and then in December. You've got all the documents, so I can speak to them. I deliberately did that because I knew that you guys, if I start speaking, would say, you cannot speak out of vacuum. We have no evidence. So I decided to supply you the official evidence. Why they did that was for countries to budget and project and bid for their vaccines that they would need. This brings me to the question. At that time when those indicative prices were put out, the exchange rate of the dollar to the cedi, if you look at the indicative prices, they are all in dollars. The exchange rate for the dollar in the cedi was not different from the exchange rate of the dollar to the cedi today. As a result, when we read our budgets in November, the money in our health line technically cannot buy the quantity of vaccines we're projecting to buy, because we have budgeted in cedis and the money we need to supply is in dollars. And if you want to check, listen to the Minister of Health's own speech about how the 72 million was dispersed and see the changes in the cedis that were supplied to the WHO and to UNICEF. You would realize that we were using more cedis to pay for less dollars. And as a result, because the prices are fixed, we're getting less doses in. This is the problem. And the other thing is, because when we budget, it's not like the Ministry of Finance releases the money in bulk to the Ministry of Health. It comes in small quantities. So anytime they get the money, we're losing anyway when we are going to pay the people who are supplying us with the vaccines. So we cannot buy the amount of vaccines we projected to buy. That's the first thing. The second thing is, because these manufacturers projected slightly lower and other countries have put in bids, when you go, originally what they used to do was, when they do their projections to manufacture, they would put what we call an average on it. That's a small quantity just in case uptake goes higher. In that case, if a country says bids late and comes in for supplies, they have some stock that they can give you. On this occasion, they've not done that because the trend is going downwards. So they are erring on the side of caution in manufacture. And that is why you hear the health minister say in the next few weeks. If you remember when they started, they said it will be sorted in 2 weeks. Now they're saying in the next few weeks because the manufacturers cannot give them an accurate timeline because their manufacturer is to people who have already placed their orders. And you see, I am scandalized because when we are talking to ourselves in a crisis, we need to talk in a manner that we learn. If we don't learn, we would come to this over and over and over again. We were in this same supply chain quagmire with COVID vaccinations, and I made these same explanations on your network. We are back here again. And for me, the question I ask myself is this: when would we start taking responsibility for our failure? Rather than always blame the man behind the tree for what happens to us, when would we go out and happen to things and stop letting things happen to us? This is how Kojo would start.
So, I mean, look, I think if we are to follow the detail that you've shared, it's quite clear that it's not because these vaccines are not available to us, but we have made a series of decisions that have put us at the back of a queue, if you will.
Well, we are I wouldn't say necessarily at the back. We are in the queue, but we are definitely not in front. And we are not priority. We are trying to be priority now because we have a crisis. And yes, the WHO and others will try and make us priority because they don't want outbreaks. Because like you said in your preamble to introduce this, once there's an outbreak, it can go global. Because it only takes somebody to travel with a child to another country for something else to happen if they are infected. But the point is we need to learn. My emphasis is not a blame game. It's about let's learn. Let's stop always blaming other things and feeling sorry for ourselves that things happen to us. We have the capacity to go and happen to things. We have the capacity to go and happen to things, but we are failing to go and happen to things and always letting things happen to us. And that is why I'm scandalized.
Okay, so what decisions should Ghana have made differently to have avoided this outcome?
Okay, Kojo. If you see the price list I've given you, the prices are in dollars, which means you are definitely going to pay dollars. I know the Ghana Health Service would have projected, because we have accurate population numbers from the last census. We know our fertility rate, so they would have projected and they would have a clear idea because we have one of the best extended programs of immunization. So they'll have a clear idea of the number of vaccines they need. As a result, because the prices had been out long ago, we would know the cost of these vaccines in United States dollars. We also knew by June that the city was in free fall. So the first thing we should have done was that once our budget was read, we should have ring-fenced this money in United States dollars in the central bank, waiting to buy us vaccines. That was the first decision we should have made. And that probably is out of the domain of the Minister of Health. So we should have had money that is commensurate to the vaccines that we need in the currency that we are going to transact business. That's the first thing. Because if we didn't do that, then every time we're going to be playing catch up, because any day we are transferring, we are subject to the exchange rate at the time. And that was going to give us problems. That was the first thing. The second thing was we probably should have known, because this has been started. If you listened to people and all that, this has been going on for 3-4 months. We should have known that we were running out, because don't we know the stocks of vaccines we have in our cold chain? We do. So we should have known that we needed to accentuate our demands because our supplies were dwindling. As a result, we should have known our uptake had increased because mothers and fathers were going in with their children. And we should have upped our uptake. Thirdly, when it started, we should have put communication out to allay the fears of parents and explain to them the situation clearly. This attitude where we try to treat each other like kids and don't hear, don't say, here and yet time form of communication doesn't work in health. We should have been honest about the situation. At least these are 3 things that we could have done that would have given us a better outcome.
Right. Okay, so I suppose the only question remaining is, how do we fix it? We've got 2 weeks, a window during which babies are vulnerable, people are still queuing after the few ones that are in the system. How do we manage this situation over the next few weeks to ensure that we do not endanger the lives of these children unnecessarily, and also that we don't ever end up in such a situation again?
Kojo, the first thing I ask you, and it's rhetoric, is since when did few weeks become a timeline? What does few weeks mean? Does it mean 2 weeks? Does it mean 2 months? Does it mean 6 months? So, first and foremost, we should have a clear timeline as to what we are working against. Without that, and an end point in sight, nobody can hold anyone to account. Because if I told you 3 weeks, as a journalist, now can you go and ask the Minister of State Health 5 weeks later that, oh, why is this? He told you 3 weeks. Why are you asking after 5 weeks? Did you say 5 weeks? 3 weeks is so open-ended that it is a chasm or a joke. They need to give us specific timelines as to how this thing is going to be resolved. Number 2, we need to get the communication right. Because what you also don't want is when supplies start coming in, a mad rush that we cannot cope with. There needs to be communication that would get the concerns of parents down. And thirdly, we need to be upfront with our suppliers. That is, if we have the money. Because, Kojo, you see, one thing we all forget is the elephant in the room. We are cash strapped. Is there an issue that we actually don't have the money and we are not being told, I don't know, you don't know? Is it that the few weeks is incumbent on us getting the IMF deal, which means that some dollars will start coming in and therefore it will help our balance of payment support and we'll be able to make some payments? You and I don't know. So this whole few weeks that is being said is so ambiguous, and we need to unravel that. We need to start holding people accountable for the mandate they are supposed to deliver. After all, they beg to serve us, not to lord it over us. So that is one of the ways of fixing it. We need to have firm timelines so that you, the duty bearers in the press, can ask questions. And they need to come and tell us exactly what the constraints are. And you see, Kojo, when part of the reasons why I got scandalized was when I heard the Minister of Health read that statement, I was like, didn't we hear the Ghana Health Service Director General say that the issue was due to exchange rates? Or suddenly, that statement that was made by Dr. Patrick Abwadi is rendered irrelevant. So if it's that, they should come and tell us, Kojo. We cannot fix this without getting to the bottom of what brought us here. So if you ask me how to fix it, we fix it first by asking the fundamental questions and identifying what the problem is, and then finding out if it means we have to get finances from other parts of the budget to prioritize health, then so be it. But without us knowing unfortunately, I cannot give a clear answer to that question.
Raymond, Winston, I mean, one of the things that bothered me from the beginning was the difference between what the finance minister told us and what the Ghana Health Service told us. That difference was quite clear. They said that it was funding, exchange rate. And the minister says, no, global decline. I mean, they can't both be right. Can they both be right?
In fairness, we have had that difficulty, right? We have had that difficulty, and it was also mentioned with communication. It's almost like we have this pressure. Let's go and tell them a story. Let's first pretend it's not happening, and let's not respond to it. Or the cause, let's pretend that there's a small problem, so we'll fix it in the near future. Then when it becomes so glaring, let's go and tell them a story. That's how we have dealt with some of these things. But when you hear, and quite frankly, one of the things that nobody expected us to be discussing in these times is something to do with vaccines and vaccination and the connections that we've had with it. Because some of these things, they just happen without people noticing them. We read LPMs and we also share information about the routine vaccination and all of that. I don't recall the last time in the Republic of Ghana we had this problem. We don't get the point that when we take 2 steps forward and we take 4 back, it sends a signal we are not a serious people. And this does not just happen. We know. And you see, Bernice was talking about 3 months ago. The indications were on the ground that they couldn't get it. But from that time, it was denial and pretense all through. Until we're now pretending that all of a sudden we realize that it was now that we're having a problem on our hands. There are people whose responsibility to plan and deliver this consistently. They go to work every day. They are paid. Their job is to make sure it happens. But nothing would happen to them because this is the Republic of Ghana. Everything, you can get away with everything. But I mean, in all fairness, this is also the same Minister of Health anyway. So me, I take some of the things he says with a pinch of salt because of his history, especially when it comes to the area of vaccines anyway. So I am not sure whether, even with their promise of a few weeks, so imprecisely stated that they can maneuver around it. But this is crisis communication. How does imprecise statements fix crisis communication?
I just want to check one thing with Dr. Kwame Sarpong-Asiedu before we thank him for his time. Doc, let me ask you this. Look, at this point, we are no longer Ghana beyond aid. We need aid. Are there some countries, by your analysis, that have these vaccines but are not likely to be using them because of this global decline, that we can go and, go cap in hand and go and beg them to give us their excess so we can immediately attend to these children while we try and figure out what a few weeks means?
The simple answer is I doubt. And that was why I referred to the WHO, United States CDC, statement, and I made the correlation with production. Because there was a decline, production also took a decline. We meet the demands of the time. So the supply chain is what it is at the moment. If it goes up, then obviously the manufacturers will project. And that is another thing that we need to, for want of a word, take cognizance of. The minister said something, because I hear the NDC gave a press conference and said that Gavi wanted to withdraw some vaccines from Ghana, and the minister said that was untrue. I haven't heard the NDC statement, but I can say one thing for sure. Once you become a lower middle income country, donor agencies tend to move away because, vaccines are bought by co-financing. Yeah. The government pays part and our donors pay part. But once you become a lower middle income country, the donors decrease the amount they are prepared to commit to you. In vaccines that are seen to matter in diseases that affect disproportionately poorer countries, because they think that you are better off and you can afford it. So we should direct the money towards the countries that are worse off than you are. I know that conversation has started in Gavi. So if the NDC said that they were, because we were old or something. That might not be the case. But yes, it is accurate to say that Gavi are considering decreasing their funding to Ghana through co-financing because we are a lower middle income country. And but unfortunately, what they should also know is that we are cash broke. And you see, that is why I'm saying that we need to get to the bottom of these things. A lot of the statement that was made, I was listening, because I listened in the office and then I started driving, and I was shocked. I was like, these are things that are made. These are things that you can place. I can give you contacts in Gavi. You can place a call to them, and they'll tell you. They are known. For those of us who are operators in this sector. So why are we trying to shroud these things in secrecy? That is what I don't get.
Realistically, by your reckoning, how soon can we lay our hands on some vaccines?
Oh, I said this 2 weeks ago, and I'll say it again. I think we should, most likely, in the next 2 weeks, we should get some supplies coming in, because I dare to think this is hell. I dare to think that the WHO, UNICEF, and other things will just see us struggle and struggle and struggle and struggle. They definitely would know that this is a crisis. And look, they've got country representatives. They listen to stations like yours and other stations talking about this. And these civil conversations impact global decision making. And as a result, I can see us getting supplies. Not because of anything extraordinary that perhaps we are doing, but because we have gotten ourselves into a crisis. So that is how I see it, that in the next couple of weeks we might get something, and then it might start going up and up and up and up, and then the system will come. That, the caveat is, that is if we have money. That I don't know. But I'm just looking at how the thinking works and the dynamics go when crises happen in the health system, and saying that this is what I can predict would happen.
Yeah. Dr. Kwame Sarpong-Asiedu, I want to thank you for your time with us. We appreciate the information. Even though I've got to tell you, it doesn't fill me with any kind of gladness to know this is the situation we are in as a country. We failed to plan once again, and so now we are at the mercy of other people's kindness. And we gambled with the lives of our babies on this one.
Well, so, Kojo, I mean, if you listen to the minister, clearly, he's talked about, low uptake in vaccination. Now, it's simple. Vaccination is the process of administering vaccines, right? So if you don't have the vaccine,
You can't administer them.
But, I mean, so globally, yes, you've seen a decline in vaccination. But that's because there's a reason. So what I did was quickly to check the CDC. I mean, they announced this. And the CNN did a wonderful example of what was happening in the US. Now, if you get onto their website, in an article dated the 18th of January 2023, it says, what accounts for the decline in vaccination numbers? And there's the answer. There are probably many factors. First, there's been substantial disruption to the U.S. healthcare system during the COVID-19 pandemic. So many children missed routine visits to pediatricians during which they could have received vaccines due to pandemic restrictions. First point. Second, disruption to schooling has also played a role. Vaccination requirements are often checked prior to the start of the school year, when schools stopped in-person instruction that led to some families falling behind on their immunization. 3, misinformation and disinformation around COVID-19 vaccines may have seeded doubts in other vaccines, and vaccine hesitancy and misinformation were already major public health concerns before the coronavirus emerged, but the pandemic has exacerbated the issues. Okay? So this is the United States doing some bit of analysis on what may have led to a decline in vaccination.
And I'm glad you've raised that difference, because in essence, what the CNN is explaining in that article is that this is a reason why some children have gone past their vaccination date without getting it.
Exactly.
But this does not explain why, if your child goes to the hospital today, they cannot get vaccinated.
No. It doesn't say the vaccines are not there.
Okay.
It is actually telling you that those who are being vaccinated, the numbers are reducing because of these reasons. And that is indeed the situation. And Kwame has made reference to some of these things. I just felt that we should put it in perspective because the minister consistently talks about a decline in vaccination. And the decline in vaccination is not just because of this. Now, watch this critically. Let me just do something here. So, if I operate a business that procures, let's say I run a pharmacy, I would know every day, for instance, how much we sell of each drug. I would know the periods that we sell, certain drugs the most.
The trends.
The trends. I would know because whenever we get into the cold areas, period, I probably would know that there's likely to be a flu. And if there is a flu, people would come and purchase this kind of drug. And I also know, for instance, the shipment period. So the time that I would order and the time that I get the drugs in the country and the time that I can clear the drugs and put them in my warehouse or in my storeroom. I would know all of this.
If you are good at your job.
Well, if I am running an effective pharmacy, I would know all of these things. And so whenever I am running out of drugs, immediately I would know.
Yeah.
And two, because I purchase this all the time, and I know that there's a likelihood that the prices may go up, as part of my monitoring processes, I would check the pricing too, all the time. Because if I don't check the pricing, I would not even know the rate at which I must sell it. So if I do all of these things, it would end up in one thing, that I would always have supply so that people do not show up and say, then I tell them there is no supply. The critical question is, at what point did we realize that we had to procure and that we were running out of stock? Previously, how were we doing it? But when COVID-19 started, what sort of other checks and research did we conduct to know that there is a likelihood that because, and look, I did a lot of research before coming here. As far back as 2021, there had been decline in vaccination. So this is not something that happened today. For us to say that it happened in 2022, and so it happened in 2022, and then we were caught unaware. In 2021, there were concerns. The WHO had started raising concerns. And the essence of people being placed in positions is that they are able to monitor and warn authorities that if we don't act smart, we may be found wanting. Did we not see all of these things happening? And that's where the question about money comes in. At what point did we realize this? And at the time we realized it, did we have enough money to have made procurements? Look, where we find ourselves today is becoming our attitudes too much. That we have persons in our positions that are expected to do a lot of things to help this country develop. The person who is supposed to monitor global trends, the person who is supposed to monitor, look, we know the number of kids that we have in this country. We know.
Annual birth rate.
We know the annual birth rate.
Estimations are known.
We know.
Population growth rates.
We know.
We
know. In fact, we even know when our population will double.
So you know what? Let's leave this last thought in the minds of everyone. You know, Raymond, you talked about the fact that sadly our health minister's reputation for getting some of these things right has been put into question in the past. On this occasion, I want us to think about things carefully because Winston is right. We know all of these things. We knew as far back as March last year what the prices would be this year for vaccines. The prices were adjusted in October and again in November. So by the time the the health ministry presented its budget, there will be money in there for vaccines. Is it the case that that money was given to the health ministry and they used it for something else? That's why we ended up late to get vaccines? Or is it that that money never came? And if it never came, who held it back? What was it used for instead of our children's vaccines? What did we prioritize over the lives of our babies? What? Where is that money? Because it was in the budget. It was there. So where's the money? What has it been used for instead of that? And if it is just generally the fact that we don't have money, now who caused some? This one, dear, the same way that we know how many children we are going to have, we know how much the vaccines will cost, we know this, that. We also know how we ended up broke. We know every decision that led us here.
But
It's only
there's
the
no-
people
see,
who made the decision who act like they don't know.
There's no excuse here.
Yeah, and
Whatever government prioritizes, it can do.
they deliver.
If this is a priority,
Thank
can
you.
supply it.
Thank you.
So let us prioritize it.
So that no, the problem is we didn't prioritize
So
it.
now-
so the
yes.
question is who made
For that
decisions not to
person,
prioritize
yes, of
this?
course, we should be dealing with them. But
Yeah,
again,
I get you.
That's-
Yes,
that-
we should actually get answers, and you see,
Yeah,
the accountability is also
accountability.
important.
That's
We let this
accountability.
thing slide. Then another event comes. Then we are still people are being paid to
Precisely.
do this. If you cannot do it, you should let go. But more importantly, for a country that could celebrate its independence celebrations not long ago, for a country that has money for so many other things, there is no excuse in the world today that prevented us from getting vaccines. Some of these children, the only benefit they'll have from the state is the vaccine they are
Exactly.
getting. And if you cannot deliver vaccines in this time, what else can you deliver? And you see, we are acting like a very rich father who is very irresponsible and knows well that I don't have money, but flaunting useless projects and useless engagements when the reality is that I have to deliver on the most important part. You have not paid school fees. And yet, the things you do with your money sometimes are completely nonsensical.
We're digging a hole in the middle of Accra for somebody's cathedral. Hey, all right. Listen, let's take a break. Let's all calm down, drink some coffee, and then come back to talk about something less stressful: the state of the nation.